I now give the floor to the Deputy Secretary General of the United Nations, Her Excellency Amina Mohammed.
Thank you, Excellency Dennis Francis, our President of the General Assembly. Thank you for your kind words. Excellencies, distinguished guests, and especially Vanessa Carter, who has joined us here today. I'd like to begin by thanking His Excellency Mr. Francois Jacquemin and Her Excellency Ms. Vanessa Frazier, the permanent representatives of Barbados and of Malta, for their work to facilitate September's high-level meeting on antimicrobial resistance. I'd also like to welcome our colleagues from the WHO, representing our DG, Dr. Tedros, and the work that they have done. I'd like to thank our AMR Global Leaders Group that's chaired by Her Excellency Prime Minister Motley of Barbados and the quadripart organizations for their continuous support. And let me give a shout out to Dame Sally Davies, who a few years ago fed me advocacy on AMR morning, noon, and night, putting it on to the agenda. And it's really important that advocates like this are with us every day, reminding us of the importance of this issue. Colleagues, we meet at a moment of profound global uncertainty, new and protracted conflicts, escalating debt, and the triple planetary crisis of climate, biodiversity loss, and pollution are preventing investments in sustainable development. On the heels of COVID-19, public health systems continue to face growing pressures. New resistant pathogens are on the rise, and as a result, AMR is jeopardizing global gains in healthcare. In 2019, nearly 1.27 million deaths annually were directly linked and 4.9 million deaths associated with AMR. By 2050, the potential impact is estimated at 10 million annual deaths, dwarfing that of COVID-19. The implications to human, animal, and planetary health are massive, with food security and the broader economy also affected. The cost of inaction for millions of people, especially in low and middle-income countries, will be catastrophic. Recognizing the scale of the challenge requires bold political commitment, access to current antibiotics and sustainable financing, and investment from all sources. Progress will also hinge on multi-sector cooperation, technology, innovation, and research. Advocacy, data, and accountability mechanisms are also critical for public engagement to be informed of preventive measures. Today's multi-stakeholder hearing is an important step to prepare for the high-level meeting on AMR on the margins of the General Assembly in New York in September. Excellencies and friends, September's high-level meeting comes after nearly a decade of increased awareness and action on AMR. World leaders signaled their commitment to curb the spread of infections resistant to antimicrobial medicines in 2016, with a political declaration that underscored the need for collective action. Since then, high-level meetings hosted by the Netherlands and the Sultanate of Oman have helped enhance international cooperation and build and keep the momentum of political will. The UN system also mobilized political attention through its global health engagement strategy, positioning AMR as one of the three main pillars. Learnings on AMR through the One Health approach have also facilitated critical shifts to tackle cross-sectoral challenges, building the case for prevention of disease emergence at the source and achieving equity and health for all. We must use this momentum to also finalize the global pandemic treaty currently under discussion. Your views today will help to achieve a better understanding of the current dynamics of AMR at different levels of governance that will shape a coordinated response that delivers for all. Leadership will be critical to find solutions to multidimensional challenges and to harness the engagement of the private sector, civil society, women's networks, among others. I therefore encourage all of us to use this meeting to broaden the conversation, to elevate the political significance of the AMR challenge, reignite the urgency and the necessary actions to ensure that we leave no one behind. I look forward to your concrete recommendations that will help us to drive action on AMR, informing Member States' deliberations ahead of September. Together, let's confront the AMR threat and build a future of health, prosperity, and environmental sustainability. Thank you.